COVID-19 update for July 22nd. I am joined, of course, by our Health Commissioner, Dr. Gail Burstein, who you may have seen go across the screen, but you'll see soon enough. And, of course, Kendra Schmidt from Deaf Access Services, who's providing the American Sign Language for today. The information that is being presented is as accurate as it was put in at the time the presentation was prepared, which was basically finished in the last hour. And always, sometimes there are some changes, so just throw that proviso out as we always do. There are 8,005 total positive cases as of yesterday. We actually had reported 8,006, but it turns out one of those individuals was a non-county resident, so they were taken out of the number. So 8,005 total positive cases out of 192,380 tests that were administered. These are not duplicates. We've had some people ask, well, if somebody gets tested twice and they're positive, does it get added in there? And the answer is no. These are 8,005 total positive cases per person. So 8,005 people in Erie County have at least one time or another tested positive for the coronavirus and had COVID-19. So these are not duplicates. 663 people, unfortunately, have perished from COVID-19. As we've noted before, these are all lab confirmed cases before they die. So while they were living, they had COVID-19, and there are no presumed positive cases with regards to the cases themselves and the deaths. They were all actual cases, and we certainly offer our deepest condolences and sympathies to the loved ones, family members, and friends of those who've, unfortunately, we've lost as a result of COVID-19 in our community. On July 20th, there were 34 individuals admitted to Erie County hospitals for COVID-19. 8 of these individuals were in the ICU unit, and 3 individuals required a ventilator. This is the number for all of Western New York, which was 35 hospitalizations, 8 of them in the ICU. And when we look at the Erie County totals for the same day, it was 34. So that means there's one individual that's somewhere in Niagara County, Chautauqua, Cattaraugus, or Allegheny County that was in hospital with COVID-19. So there's 34 in Erie County, 8 individuals in the ICU, 3 on the ventilator. Except for the peak of approximately a week ago, we've been averaging about 30 in the 30s for the past few weeks, and that's a good thing. Ventilator usage is at its lowest since the outbreak began. We've had questions, well, what does airway assist mean? It means you're basically on a ventilator. So we're at the lowest numbers of ventilator usage in the last couple of weeks. That's a good thing. There's also new protocols and procedures that are being used by hospitals now. They're not immediately putting someone on a ventilator if they can avoid it. And on July 20th, we had no one die in Erie County Hospital. We did have a few deaths in the days before. We haven't seen more than one death in over 2 weeks in a hospital on a daily basis, though we have had occasionally more than one death on a daily basis if somebody died outside of a hospital, whether it was a nursing home or at home themselves. Cases by age and gender, this had been pretty average throughout, and of course we see the growth in the 20 to 29 age category. It's now the fairly largest of the categories when we break it down by age. So the number one category for those who are testing positive is 20 to 29. It has surpassed all other categories at this point for the 8,005 cases that we have had since day one. And as we noted just recently, it was yesterday actually, these days sometimes get all mixed together, but when we did the results for last week, and this is for the week ending of July 18th, 35.6% of all new cases last week were in the age group of 20 to 29. And the positivity rate for 20 to 29-year-olds was 3.4%, which was twice the total for what all were, which was 1.7%. So we are seeing that 20 to 29-year-olds are testing at a higher rate of positivity than all others combined. But it was actually double because the total for the entire week of July 18th, including all age groups, was 1.7%. And the 20 to 29-year-olds tested at 3.4%. So it doesn't take a mathematical genius to realize that the vast majority of all other age groups were below 1.7% on average. So that is always what we've been concerned about the last few weeks, which is the growth. of positive cases in the 20 to 29-year-old age group. That age group generally can get through COVID-19 okay. We have seen cases, including in Western New York, the 22-year-old from Wheatfield who unfortunately perished from COVID-19 related illness. So just because you're young doesn't mean you can't get sick or potentially die, but you certainly can pass it on to someone else, including your family members, your loved ones, your coworkers, and they could have a much more serious reaction from COVID-19. So we're continuing to watch this, and it's not something we're happy to see. We don't like seeing that number increase in the younger age categories, and it continues to increase, and that's not a good thing. Cases in Erie County based on gender and residence. This has been pretty equal recently with regards to males and females making up 56% of all cases. And when it comes to residents, that people in the city of Buffalo are at a greater rate of COVID-19 positive than they should be based on the population trends of the city making up about 28% of all Erie County population, but it's making up about 46% of all COVID-19 cases in Erie County. This has been fairly the same for the last month at least, but we're not really thrilled to see that we still have higher numbers in the city of Buffalo than we would expect to see based on just the population in general. And this goes into some of the issues that we dealt with regards to health disparities among individuals who live in the city of Buffalo and why we took some specific actions early on to help address that. Diagnostic tests. Here's the average of what we've been seeing on a weekly basis going back to March, where at one point there were over 30% of all tests that were being performed in Erie County were coming up positive. We also were doing a lot less testing back then. Now we're doing a lot of testing, and the last week, of course, was 1.7% of all tests came back positive, and as I noted in the age category of 20-29, that was actually 3.4% positive. So we're still fairly low with regards to the overall tests that are coming back positive, but we have seen a slight uptick in the last couple of weeks. And we are worried about that age category of 20 to 29, because if that continues to grow, that means that overall number is going to grow. It's as simple as that. We just know it because there's going to be more community spread as a result of the continued coronavirus. Antibody testing, less people are getting antibody testing than we originally saw, but there were still 2,622 people who got antibody testing for the week that ended July 18th, and 149 of them tested positive at a positivity rate of 5.7%. And the total rate since we started doing antibody testing in Erie County is about 5.6%, which once again means that 94% of the population, if this average is correct, we think it's pretty correct, 94% of the population has not contracted the coronavirus, has not come in contact with it, which means you are still susceptible to it. You do not have antibodies. And I know Dr. Burstein's got some more information that we've received recently regarding whether antibodies actually exist for a long period. And I think the response she had in an email she sent to me with regards to the latest response was bummer, right? Yeah, it's not big bummer because the antibody tests or the antibodies may not last as long as what we would hope they would to protect people in the future. So just because you think it's safe out there, 95% plus of the population, or 94% plus of the population in Erie County have not come in contact with the coronavirus and contracted it and are at risk for contracting it in the future. Mortality data. Seen this information in the past. The vast majority of deaths are individuals in the 70 and over age category, especially the 80 plus, and females make up not almost double, but nearing it, the amount of deaths in the 80 plus category. And we believe that's primarily because there are more females that live 80 plus than males to begin with in the first place. But yes, the COVID-19 illness, the coronavirus, has certainly had a negative impact on our older population, as was predicted coming out of China and Italy. So it's not a big surprise to see that the vast majority of deaths are individuals 70 and older. And then in the age range, as well as the residents, as we noted, say Buffalo makes up about 28% of the population, but it's only made up 24% of the deaths. That's a very good thing. We've seen other communities across the United States where it's much higher than what the population is. And when it comes to the age range, once again, 58.2% of the deaths were people 80 and above, 21.9% were 70 to 79. There have been individuals who've deceased that are younger than that, but the vast majority of people who've deceased from COVID-19 are those that are older. We just continue to see that trend. Ethnicity, we have 80.6% of the population in Erie County, based on the census numbers, are white, and 81.1% of the deaths are whites. Blacks, African Americans make up 14.6% of the population in Erie County, and they made up 16.4% of the deaths, which is a little higher than what the population ratio is, but it's much better than what we've seen in other communities across the United States. And in general, we're right in line with the population trends for our community, which, as I said, some of my colleagues in other counties across the United States can't say the same. There's been a disproportionate number of deaths for African Americans, people of color, and we're not necessarily seeing that here in Erie County. Testing, I'll turn it over to the doctor. Let's talk about all the testing stuff, give it a little spray, and put on my mask, which we like to talk about because it is the best way to protect yourself. So there you go, Doc. I'll even clean off this.
Wow.
I don't know if that's good for the wood, but whatever.
Thank you. So just want to just remind everybody that we do have a lot of testing availability in Erie County, both diagnostic testing and antibody testing. And to schedule either from Erie County Health Department, you can call 716-858-2929 to schedule for the antibody test. We actually have online scheduling available at erie.gov/COVID test. So remember, these are free to the public. There is no charge. You don't need a laboratory rec or a doctor's referral. They are by appointment only, so we do need you to call. Our clinics are getting very, very full. You know, nationwide, there's a large demand for testing, and our tests are hot because we are able to turn the results around in 48 hours, which most labs in this community cannot do. So we want to make sure that everybody who needs a test can get a test, so we're asking to schedule an appointment. We have clinics throughout Erie County, and so again, please, if you make an appointment, show up, because we don't want you to take the spot of somebody else who does need the test. So for our diagnostic testing, and we have a photo of our team on the upper right, we are testing 3 times weekly. We're in Williamsville on Mondays, Orchard Park on Wednesdays, and in the city of Buffalo at 14215 on Thursdays. For antibody testing, we're rotating throughout the month to all different areas of Erie County. So on this Thursday, we're going to be at Hispanics United in Buffalo. And then next week, we're going to be in Newstead and in Northwest Buffalo Community Center in the city of Buffalo. So again, we will be in a place near you. So again, if you are interested in going somewhere else for testing, we have our interactive test map available. So just click on one of the purple stars, and there'll be a little window box that'll pop up and give you information about the testing site. What you need to bring, if there's insurance or not, or a lab rec, or, and they do antibodies or diagnostic testing. Pharmacies are included on this list, so you can go to erie.gov/COVID test sites to get this information. So I'm going to talk about Erie County Responds. Spritz where I was.
Thank you, Dr. Burstein. We've had some people comment saying, we heard that you were getting PPE, but how much of it did you actually distribute? And in Erie County, we have distributed millions of pieces of PPE. In fact, since the COVID-19 outbreak began, Erie County has provided personal protective equipment, PPE, to hospitals, nursing homes, medical offices, law enforcement, EMTs, first responders, and our residents, kind of in that order, because we have a responsibility to deal with the healthcare professionals first. We have actually distributed 1.9 million pairs of gloves, 2.7 million procedural masks, 359,000 plus N95 masks, 131,000 goggles, about 67,000 face shields, 115,000 gowns, Gowns have actually been very difficult to get a hold of. And from New York State, through New York State, we've received the New York State Clean Hand Sanitizer, and we've distributed 121,010 of these little 2-ounce bottles. Our PPE distribution logistical program has been very, very large. We have a warehouse that we store the PPE in, but it's not just storing it. It's constantly coming in. It's ensuring that it's going out to the right parties. Parties that are entitled to a certain percentage will get a certain percentage of it, and only that. We have a huge operation with regards to the control and distribution of personal protective equipment to those who qualify. And as we noted, our first responsibility has been maintaining and ensuring the PPE for our hospitals, medical facilities, law enforcement, EMTs, first responders. So some folks are like, well, why didn't you just give all your masks out to the general public? Well, our first responsibility is to ensure the masks go to hospitals and healthcare facilities and the like, and to ensure that all of these parties that we have a responsibility to ensure they have PPE have it. And then when we felt comfortable at that point that we could start distributing masks and other things out, we've done that and we'll continue to do that. The operation for PPP procurement is not over. It's just like our operation for testing. We are continuing to obtain supplies for testing, both the diagnostic test and the antibody test. We will continue to do that so we have sufficient supplies, even if the other parts of the countries don't. I noted yesterday, we were asked how many testing kits. We have over 36,000 testing kits, swabs, on hand at this point to cover us through the summer and the early fall for when we believe there will be a second wave. We are getting refilled with reagents every 2 weeks by the CDC. There are only 3 CDC-approved labs in all of New York State. The New York City lab, the Wadsworth lab, which is the state lab in Albany County, and the public health lab for the county of Erie here in Buffalo. And as a result, we continue to get supplies through the CDC for reagents, and we've acquired more than 36,000 pieces or testing kits, which we are also helping to use with other partners as well. So I want folks to understand that the operation associated with ensuring the safety of our public continues. It has been going on for more than 4 months now. When it comes to the acquisition of PPE, the acquisition of testing kits and the like, we are doing it not only for ourselves, we're doing it for the region. And it's been a very, very, very encompassing operation. Logistics-wise, it's one of the largest logistics operations that Erie County has ever had. But I'm proud to say that because of the great work of the folks in our purchasing department, our Homeland Security Emergency Services Department, our Department of Public Works, our Department of Health, that we've been able to meet the needs of this community while other parts of the country are struggling for PPE or struggling for testing kits. And it just says a lot about the hard work of the people that have been working in Erie County government for quite some time to ensure that. And even the sheriff's office, which is guarding and ensuring the safety of our PPE, because we know that's a hot item. And so we're ensuring that everything is done properly, it is safe, and it is distributed out to those who need it based on the priority list that we have. Schools, talk about schools and then turn it over to Dr. Burstein to talk a little bit more about schools and some of the conversations she's had, and to let her move on with some of the other items. School districts, of course, are writing reopening plans. They are due to the New York State Education Department by July 31st. So basically in 1 week, they have to provide their response as to whether or not they can meet standards has been set by New York State Education Department. We've heard from a lot of folks that childcare is a very big concern, especially as they've returned to work. Remember, one of the first things we did in Erie County in response to the COVID-19 outbreak was to create a childcare task force, and that exists still to ensure that their people are properly put in place with childcare providers that exist, including in their community. So we have a daycare unit in the Erie County Department of Social Services at 858-8953. You may qualify for a daycare assistance subsidy through Erie County. You really, a lot of folks think, well, I have to have a certain number of services that are provided to me by the county to qualify for daycare assistance, and that is not the case. You can actually qualify for daycare assistance even if you're working. And there's a lot of people who work and get daycare assistance and subsidies. There's a certain dollar threshold, and we want to ensure that it's basically up to 200% of the poverty level, and you can get some assistance from the Erie County Department of Social Services for daycare subsidies. And there's other assistance that's available through other third parties. So we ask you, if you're looking for daycare but you're having problems paying for it, you call 858-8953, talk to our daycare unit in the Department of Social Services. And if you're looking for daycare and you don't know where to turn, you can call the Child Care Resource Network, which is the official designee for our Child Care Task Force, at 877-6666 to get hooked up and put in contact with a daycare provider who has open spots and can take care of your child as you return to school, or if you're a teacher going to school, or if you're returning to work, or if you got a little one and the other one's going to be going potentially into school and you got a 2 or 3 year old, you don't know what to do with the day, we have daycare that's available. I'm going to turn it over to the doctor to talk a little bit more about some of the conversations he's had with regards to school districts on schools, and then move on to the rest. So, there you go.
Thank you. So as our county executive mentioned, the health department is in frequent communications both with school districts for K through 12th grade, and also I've been engaging in conversations with the University of Buffalo, and our staff has been engaging in conversations with other higher education facilities. So, we really want to make the schools, help them get it right. Our children are our most precious assets, and it's really important that they're able to return to school if it's safe. And because they get a better education, they're able to learn better. It's also really important for their social, emotional well-being. And so we're trying as hard to help the schools get the kids back safely and stay healthy. So again, if they are able to come back, we're helping the schools put systems in place so they will able to stay healthy among their students and their staff. So just remember, school is not going to look like it did when people left in the spring. There are going to be new procedures, new policies, new the way they run the classrooms. Higher eds are going to be offering a lot of virtual classes. They're encouraging students to live off campus if possible, and this is going on nationally. I mean, I have kids in colleges out of town, and they're hearing the same thing. So again, we want to be a resources for both our school districts and our higher ed, and we are working with them, helping them to answer questions and get it right to keep the schools open and help our kids return to school if it's safe. So I just want to talk about the travel advisories. So you know that the governor recently increased the number of states that have been determined to be high risk for COVID-19 transmission. So now there are 31 states on that list. And so on this map, the states that are high risk by the governor are in red. The green depicts the states that are with New York State, New Jersey, and Connecticut, where we're trying to stay safe, and we're working together to ensure that people from our states who travel outside of our states and go to one of these states in red, when they return, ensure that they remain in quarantine for 14 days, because there is a very high chance that they could have been exposed to COVID-19 and infected themselves. So we're working very hard to make sure that everybody these travelers are compliant with quarantine. If we know that the state health department is at all our airports to catch travelers returning on direct flights from these states, and making sure that they are reporting themselves, and then they're giving that information to the local health department. So that would be us in Erie County, and then we are following up with that, and also giving information to the state health department contact tracers to help us follow up with those travelers. So if you did not complete one of these forms, say you were traveled by like bus or car or train, you can self-report yourself on the Erie County Health Department on our COVID-19 site at erie.gov/COVID-19/travel form. Also, if you want to report somebody, a friend or an enemy or a coworker or a neighbor, you can complete this form. Again, we really want information so that we'll be able to contact them. So we'll need to complete name, address, and phone number so we can get in touch with them and making sure that they are able to stay in quarantine. So we are reviewing these reports of returning travelers every day, and we probably have about 1,600 reports so far. So it's very, very busy. So, remember, the most strategic plan, the most effective plan for public health is to put systems changes in place in the community to make it easier for people to make smart choices to stay healthy. And the governor has helped us by issuing these executive orders to ensure that these systems are in place. And he's put it onto the health departments, local health departments in each community to make sure that we enforce these executive orders to make sure that, again, when people go out, they're able to stay safe and healthy and not exposed to COVID-19. So the Erie County Health Department is the enforcement authority for bars and restaurants and banquet halls. So if people want to issue complaints about these facilities not masking or not social distancing or having too many people, you can call us at 716-961-6800 or go to our Erie County Health Department website at erie.gov/health, and there's a form that you complete. We review all the forms. So far, since the beginning of this, we've received over 1,600 complaints about bars and restaurants. If people have concerns about other type of businesses or locations or incidents, they can either contact New York PAWS at 833-789-0470, or they also have an online form on the State Health Department's website. Or you can contact the building inspector in your municipality, and they can inspect that business or whatever the situation is. Also, just a reminder, if you have complaints about travelers, we are taking that information and can go on to the form on our website. So again, the Erie County is the enforcement arm for the New York State's executive orders and the State Health Department's guidelines for food service establishments. Remember, we showed you data earlier in this presentation that the people who are becoming positive at the highest frequency with COVID-19, they're becoming infected, are people in their 20s. And from our contact tracers, we're hearing that these individuals in their 20s they're listing exposures, going to parties, going to bars, crowded restaurants, not masking. And so that's why we have to try so hard to enforce that, help these bars and restaurants and establishments, making sure that they comply with the executive orders so that people won't be tempted to go to these establishments where they can't get infected. So we are issuing violations for any of these facilities that are not complying with the governor's executive orders. So every single complaint that we receive at the health department is investigated. Again, we don't want to just randomly, shut down at places. What we do first is we contact each facility where we get a complaint. We call them, provide them education over the phone. We also give them a letter so they have all this information in writing. And then we may go out and inspect them. We might send a public health centenarian out and just to inspect and to see if they are really complying with the executive orders or not. So if we do go out with this public health sanitarian and they do find a violation, they will ensure that the owners and the managers of the facility rectify that violation on site. So usually it's too many places, so we have them clear the house so it gets to an acceptable level, or people not wearing masks, make sure that they put masks on or they leave. Or too many people in the place. And then after, repeated violations, if, we've told you once, we've told you twice, we told you 3 times, and people are still, these owners are restaurants and bars and banquet facilities are still knowingly deciding not to comply with the governor's executive orders and putting their patrons at risk of COVID-19, then we have to take further action and issue fines. We might have to issue a closing order, which I sign, and then we refer all those violations to the State Liquor Authority for them to take action. So we just want to remind people that it's just not about going out to a restaurant and bar. For any type of gathering that is not essential, there is a 50-person limit. So this corresponds to any type of large gathering like a celebration, like a wedding party, any type of graduation party, bar mitzvah party, anything that you have to keep the list of invites down to 50 or below. So we are getting ready for this weekend. We were seeing too many people getting infected in our community, and we're hearing too much that they are getting exposed in these large parties and bars. So our sanitarians are preparing to go out this weekend. So what we're doing is we're collecting complaints that we're receiving from the public, from employees, for people who are invited to these social gatherings. And then we're also scouring the website to look for these events. And we are contacting all the venues and just reminding them, educating them of what the governor's executive orders are, what the limits of number of people in the room and at these events, and asking them to make sure that they comply with the executive orders and cut down the invitation list, and making sure everybody wears masks, no dancing. Everybody should be at the table. If they're not at the table, they have to be social distance and wearing a mask. It's hard to do at a traditional party. I realize that. This is what this is the state that we're in. This is what we have to do to keep our numbers down. So when we do go out to one of these facilities, like a banquet hall or a restaurant that we know is having one of these events, we're actually finding these events in parking lots too, outside the facilities. Even though they're outside, it's still limited to 50. We're going to be issuing violations, and after repeated violations, they may be subject to a close order. We are not going to close down the wedding. So we're not doing that. What we'll do is if it's after repeated violations and we feel that we have to issue close orders because a venue has repeatedly not adhered to the executive orders despite our multiple contacts with them by phone, by letter, by inspection, and we feel that we may have to close them down because we don't have another choice, we will return at a later date, after the party or the celebration. And we don't want to put people who really invested in having a celebration put them out and kick out their guests. But however, we will return to the site, and if we have to issue a close order, we will do that at the next day or the following business day. And again, we are referring all these violations to the State Liquor Authority. So moving on to contact tracing. So that's been a hot topic lately. People are really interested to know what goes on with contact tracing. And, our employers are a very important component of contact tracing. They're helping us get information about if they have an employee that is a case. We're working with employers to get information about who contacts could be of their employee, and helping us get that list of who has been exposed and who needs to be in quarantine. And then if an employee is identified as a close contact, we work with the employer to see if they're determine if they're an essential employee or not, and if they can return to work with monitoring their temperature and social isolation and wearing a mask. So employers are really important in this. So we are hosting an event with the Buffalo-Niagara Partnership for employers, to tell them everything they need to know, and we're afraid to ask about contact tracing, what employers need to know. So I'm doing this with my favorite public health director in Niagara County, Dan Stapleton. So this is free to the public. You can register online at thepartnership.org. The webinar is tomorrow at 1 p.m. So also, the Erie County Health Department, we are continuing with our health fairs. There is other important public health information that the public needs to know about. It's not just all COVID-19. We're still struggling with drug overdoses, with cancer, with sexually transmitted infection, with HIV. So we still want to give the public information about that. So we're having pop-up health fairs throughout the county this summer. So the next one is actually this Saturday at Amherst, from 9 to 1. It's at the 400 John James Audubon Parkway in Amherst. So we're going to be offering, free Narcan and these emergency Narcan boxes you can put in your business. Condoms, sexual health information, tobacco cessation information about our cancer screening program and the services that we offer, and help people get screened, and where cost is not a barrier. And then we'll also also be handing out masks and hand sanitizers as supplies last. So get there early. And remember, we open up at 9, so we are not able to distribute anything before 9 o'clock because everybody's busy setting up, getting ready for the crowd. So, please be patient. We are open for business at 9 o'clock. So I will turn it over to our county executive to entertain questions.
Just first off, I want to continue to remind the public that we need to wear masks when we're out in public. The President came out and said it's a patriotic thing to do, wear a mask. And if you want to do so, it's because it is patriotic. You're protecting yourself and you're protecting others. So we appreciate that people do the right thing when you're out in public and you cannot otherwise socially distant. Wear a mask. You will protect yourself. You will protect others. It's a very important way, and it's the easiest way that we can protect each other in our community. David.
Thank you. Dr. Bernstein, could you talk a little bit more about the testing and the ability for Erie County to get results in a couple of days? And we're hearing from doctors that they're now waiting up to 2 weeks. Is there a difference in this disparity of where they're getting the tests done? We're hearing about the chemicals. I know there's a
Reagents.
Thank you.
Sure.
The reagent shortage.
So the question is, why is it taking labs in the community sometimes a week or more to get test results back? And then why is our Erie County Health Department Public Health Lab able to get results back within 48 hours? So we're fortunate that we have a public health lab that is in the CDC's Laboratory Response Network. So we are eligible to receive testing assets like diagnostic testing, like our COVID-19 testing from CDC. So we are able to, we have the CDC's tests that they developed in our public health lab, and we have the equipment to run that, and receive all our reagents and supplies directly from CDC. So that is not in competition with any other companies that manufacture laboratory reagents or laboratory tests. It's also those reagents and tests are actually being given distributed directly through CDC, so they don't have to go through like FEMA or HHS. So that's not part of the distribution. So we have a really good supply of tests and test reagent, and we have what we need to do to get the test turnaround in 48 hours. So, and also that's why we want people to schedule appointments to have their specimens collected by Erie County Health Department. We have a small public health lab, and we can only run a certain number of tests per day. And so that's why, we cut off the number of people that we're able to test at our specimen collection clinics to a number where the public health laboratory can get the results completed in 48 hours. So the problem is with other commercial laboratories, they have to be dependent on commercial vendors for their tests and the test reagent and their pipettes and other supplies. And, there's a big shortage now because the demand outweighs the supplies. And also the federal government has stepped in, and they're regulating distribution of these test supplies, like HHS and FEMA. And so even though that the laboratories may have ordered the appropriate number of supplies that they may need to do tests, they may not be able to receive them. There's huge shipping delays that we're hearing. So this is a big problem nationally. Fortunately, we receive directly our tests and our test reagent from CDC, so we don't have to be in competition for that.
Just to follow up with a vaccine question.
Well, I think
you should wait until there's a vaccine. We see these numbers these days across the state. We are at 99% of tests given coming back negative for COVID. Fortunately, near record lows in hospitalization, daily deaths, dwindling near single digits. And I don't know how much better people expected it to be. Even if you had a vaccine, I don't know if you could do much better.
Okay.
So do you have a thought on that, or whether or not, to the people who say we should wait until we have a vaccine before we open everything up?
Well, first off, let me just address a little bit of what you were asked in the first question. which was like doctors and other places. We've gotten calls from people saying, hey, I got my test done at urgent care and it's a week now. You guys said we get it done in 48 hours. And I go, well, did you get it tested through Erie County? Well, I got it tested in Erie County. There's a difference between getting it tested in Erie County and through the Erie County Department of Health. So if you go to an urgent care, if you go to a doctor's office that's offering tests, if you went to a hospital, yeah, they have tests, but they're not sending their tests to be analyzed to our Department of Health public health lab. They're often being sent out of state, and they're being sent to like Quest or LabCorp or these other locations out of state, which do not have the reagents and everything's delayed. So just because you got your test done in Erie County doesn't mean you had your test done and analyzed by the Erie County Department of Health. And there seems to be some confusion in that. Had people reach out calling our number saying, I did my test a week ago and I still haven't gotten results. And they look up the name and you didn't get your test through us. No, I got my test at the urgent care. You got to contact the urgent care. You didn't get your test analyzed by us. And I know there's confusion out there because there's confusion among some people that I've run into who said, hey, I got my test done by Erie County and I still don't have the results. And I checked into it and found out those people didn't get tested by Erie County. You know, your question regarding the vaccine, we don't know if the vaccine's coming. There's been some good things that are coming up that we've heard about the vaccine, but I think it's important for us to understand that you can protect the general public by wearing a mask. We've taken some very stringent guidelines and restrictions in New York State to protect the general public, which is completely different than what's being done in a lot of the other parts of the country. And we have a high percentage of mask wearing in our community. And I think that's allowing us to go forward and reopen our economy and to reopen some of these businesses that were closed for a while because we're following the guidelines. When we don't follow the guidelines is when we have a problem. We've had to shut down bars. We have no interest in shutting down bars, but we've shut them down when we found out that after the second or third time that our Department of Health staff has been there, not the first time, but after multiple visits, that they're still not following the rules. People can get sick that way. So what we're saying is wear your mask and you're going to find that we can reopen certain businesses, certain types of leisure entertainment at lower capacities, not 100% capacity, but at a 50% capacity and do it safely. Pennsylvania is a perfect example of what can happen when it's not done right. Pennsylvania had lower numbers except outside the Philadelphia area, but the rest of Pennsylvania had pretty much low numbers. They shut down. Ohio shut down. Then they reopened, and they pretty much reopened everything at once earlier than what New York did. And what did you see? You saw their numbers shoot up, including in the areas where they did not have high numbers to begin with. And so what did Pennsylvania Governor Tom Wolf do about a week ago? He shut down all bars again. He shut down all interior dining. Because they realized that people were not following the mask wearing rules. They were over capacity. The governor talked about how he doesn't want to have to go backwards and shut down all bars and shut down interior dining. None of us want to do that. I just had lunch yesterday at a restaurant in downtown Buffalo, talking to some of the folks. It was nice. It was nice to go down and sit and eat side and see some people I haven't seen in a while. And everyone was doing it the correct way. So if we wear masks, we'll be okay. Hopefully there's a vaccine. There's some vaccines we've heard about that are showing promise, but they're still going to have to go through much more testing before they get approved by the FDA, which means if we're lucky, we'd have a vaccine sometime in 2021. If that happens, great. In the meantime, if we wear our masks, we should be okay. Actually, I think I was going to go to Eileen next. She was up next.
On the bar issue, the governor said he never said bars should open. Where does the confusion lie? Because so many have restaurant bars together, was that something on a county level that there was misinterpretation?
No, we were told the bars were allowed to open, but they had to open at 50% capacity. They had to wear masks, and they were supposed to be seated. There was not supposed to be this mass gathering around the bar, in a bar. And so the governor changed the rules to do what they thought, I think they wanted in the first place, but bar owners weren't really, no one was understanding because they allowed the reopening of bars and restaurants. But what they didn't want, and what we were finding out locally, is you go to a bar, you'd find 50 people all hovered around the bar, all crunched into each other, and that's where they were finding there were problems. Locally, we were seeing that here. Downstate, they were seeing mass parties and raves at bars, hundreds and hundreds of people, and which we know is not good. So they did approve bars for opening. They did approve restaurants, but at at capacity limitations. So if a bar had a previous internal capacity of, let's say, 200 people, they could not open at 200 people. They had to do it at 50%. But what was happening is bars were opening and just, everyone come in, let's celebrate. And so he changed the rules to basically better define what they thought or what they wanted, but wasn't said as openly, I guess, in the first place. Marlene.
So I know that you touched on this a little bit earlier, but there are other counties in our region that had to cancel testing days because their tests were taken away and distributed elsewhere. How do you make sure that doesn't happen here in Erie County?
Well, we have over 36,000 test kits on hand with more on order. Reagents, as the doctor noted and I noted, come directly from the CDC. The other counties do not have public health labs. There is not a public health lab that is authorized to perform this test in Niagara, Chautauqua, Cattaraugus, Allegheny, Orleans, Wyoming. Even Rochester, Monroe County does not have a public health lab. They have labs associated with hospitals, but they don't have a private public health, or a county-owned public health lab that's associated with the CDC. So we are in a better position than most other places in New York State, and for that matter, many other places in the United States. I think there's less than 60 health labs that are authorized CDC. The doctor's giving me the head bob as yes, and she can go into a little bit more. But we are one of the few public health labs that are authorized by the CDC to perform these tests, to get the reagents, and as a result, we're in a better position than most. I asked for our logistics teams to find and get as many swab kits as we possibly could get our hands on for not only the summer, but for the fall, because I didn't want to get in a situation like you're seeing elsewhere where they don't have reagents, so they're running out of swab kits. We have them, and we have them so that we're adequately prepared for whatever might happen to our citizens, whether it's the summer or the fall. You want to finish on the CDC?
Sure.
So the CDC funds and networks of public health laboratories throughout the country called, as I said, the Laboratory Response Network. And so our Erie County Health Department Public Health Lab is part of that network. And so we're able to receive from CDC some testing capabilities that other commercial labs or even public health labs that are not don't participate in this network that they can't get. So, for example, with H1N1, we were able to get CDC's tests, and so we were one of the first laboratories in in the country actually to receive the CDC's H1N1 test because we're part of this network. So we have a very good working relationship with them, and they have assured us that their supply chain is since they develop the test themselves and they produce their own reagents, that the supply chain for their reagents, that what we need to do to their tests is going to be steady, and they ask us just to order every couple of weeks to make sure that we have enough supply for the for a 2-week period, and we've been doing that, and so far that's worked really well. As the county executive mentioned, other laboratories do not have that capability to order directly from CDC. They have to rely on the commercial market, and the supply and demand. It's it's very competitive. It's difficult, and this is where many hospitals, many private physicians' offices, many urgent care centers, they rely on these commercial labs like Quest, LabCorp, other laboratories that they have to send out their test results to. And so that's where the problem is. And they're kind of in the same boat as you walk on the news and they see people like waiting in line in other states or, waiting, 10 more days for their test results. That's a national situation, which with people who are tested by our Erie County Public Health Lab at one of our testing venues that I mentioned will not be subject to those restrictions.
Just to follow up on that, can you remind us what the capacity is of the public health lab in terms of daily testing? And when you get your shipments in, is it every other week? And how many reagents do you get? And I don't know if test kits are something that's purchased separately, and whether or not
that's an issue, getting enough of those in also.
Sure. So the question is, what is our Erie County Public Health Lab testing capabilities? So we aim to, we're comfortably able to run about 500 tests a week. So we again try to split up the collection from with our nurses in 3 separate clinics. And we also will also there are special outbreak investigations that we may send nurses out to collect specimens. Sometimes since we are a regional public health lab, sometimes we receive specimens from outside of Erie County that the state asks us to run or other counties ask us to run. So we'll do that too. So we're not just running only our Erie County resident specimens collected at our clinics. However, that's the majority of the tests that we're running. And I'm not a laboratorian, so I don't know exactly how much reagent that the lab orders, but I know they know what they're doing and they order what they need to for a 2-week supply. So we have a buffer of about a month at a time, and then we order every 2 weeks to make sure that we have that buffer. So we have supplies to do testing at the current rate for the next month. Does that answer your question?
Yeah, I was just trying to get a sense to how much of this you guys get in on a regular basis.
Yeah, well, whatever the lab needs. Again, I'm not a laboratorian, so I don't know the exact volume.
And there isn't any shortage in terms of the actual swab kits.
No, that's what the county executive has mentioned, that we're, we have a great supply of the swab collection kits, the test kits that he referred to are the swab collection kits. So we have a very robust supply, so we're not going to get stuck in the summer or the fall when demand increases.
Yeah, a lot of residents are asking about the travel advisory and whether it applies to essential employees. I don't know if you can answer this or not, but if you could provide any clarification on that and to what extent. There
is an exemption for essential employees with regards to the travel advisory. The question was, does this travel advisory have an exemption for essential employees? And the answer is yes. It is on the state's website. It identifies there are exemptions for like truck drivers who are driving through states with loads and so forth. We couldn't just stop truck drivers and things like that. There are exemptions for essential employees, though they are all required to monitor their symptoms. But there is an exemption for various essential employees, including healthcare, transportation, government, and the like. So that does exist, and it is on the New York State website. I don't know the exact verbiage, but I do know it exists.
Kara can get you that information if you contact her.
Perfect. Okay, great, thank you.
Yeah, I'll go back there.
So you mentioned the example of Pennsylvania earlier. There's 31 states now that the state recognizes being high risk. So obviously the numbers are looking encouraging here, more so than other places in the country, even other places in the state. But how much concern is there, given the fact that so many other places are in a different timeline than us and seeing spikes that can come back around and hit us again? Because I know you referenced that you're fearing a little bit of a second wave.
The question was regards to what kind of concern is there towards seeing the spikes occur elsewhere and that happening here. And of course, the answer is very concerned, especially now that we're seeing that percentage of testing in the 20 to 29-year-olds last week be 3.4% positive. Remember, if our infection rate gets to 5% or above, even if we're in phase 4, they're not going to allow schools to open in the region. Our infection rate last week was 1.7%. Okay, that's all right. But it was 1.3 the week before, and I do know for the week before it was less for 20 to 29-year-olds. So if that infection rate keeps going up, even if it's not a huge increase, it's just kind of a gradual one, but we get to 5 and 6%, now I'm very concerned because we've done a great job of reducing the spread of coronavirus in our community. And if that infection rate goes up even slowly, what you're seeing is it slowly goes and then it just shoots right up. Because then it gets to a certain percentage of the population where you just have tremendous community spread. That's what's happened elsewhere in the country, is they had very low percentages, below 5%, 2-3%, and now you're seeing 15 to 20% of all tests being done in a particular state are coming back positive. And it is that slow growth. And that's exactly what happened in New York. It was a slow growth, and then it shoots right up when it gets to a certain point in the community. And that's what we're concerned about. And that's why we continue to stress wearing a mask and following all the proper protocols. We have no interest in shutting down bars and restaurants. No interest whatsoever. I want them to stay open so people can have jobs and there's revenue that's generated for the county. The only reason we'd be shutting down a bar or a restaurant is because they're not following the rules repeatedly. It's not like we just walk in and, okay, we're going to shut you down. It's repeated violations. And when that happens, it's basically, okay, we got to show you we mean business. And we're doing it to protect the individuals who work in the bars and restaurants, as well as the customers. And because if they get sick, they can transmit it to other people who can then get sick themselves. So we are very concerned, and that's why we continue to have these briefings every week. Thankfully, we haven't had to go to more than once a week lately because of the coronavirus being generally under control here. But it's still out there, and there's still people testing positive. I think, Dave, did you have the question next?
Yeah, I did actually.
I'm just going to try to go back in the same order.
Thank you very much. You said that you believe that there is going to be a second wave. Who do you base that belief on?
The question was, I said that I believe there's going to be a second wave. What do I base that on? I base it on science. I base it on Dr. Fauci. I base it on the CDC reports, and I base it on the reports that we get from the Department of Health in Erie County, New York State, and elsewhere with regards to viruses and how they mutate and they come back. We don't know what the second wave will be, but I don't just expect it to disappear. We've heard that. It's just going to magically disappear. That's not going to happen. It's not going to magically disappear. It may mutate, be something different. That's what viruses do. This is a virus. It's coronavirus. And viruses just don't disappear. Maybe our bodies find a way to handle it better through our immune systems. I'm not so certain about that. I don't know how many times we've gotten flu shots and then we still have to get a different flu shot every year just because there's a new strain of the flu. It mutates. So I believe that there will be a second wave based on science, and we need to act appropriately to protect ourselves whenever that hits. Dr. Fauci mentioned at the end of last week, early this week, I heard him in a number of interviews, we are not in a second wave yet. We are still in the first wave. We're still in literally the first 6 months. It's been 4 months since the first coronavirus case here in Erie County, which was March 15th. But it's basically been February, late January since the first coronavirus case in the United States. So a little bit more than 6 months since the first case came. And we haven't even hit the 1 year mark, so to speak, yet. So I'm very concerned that we're going to have a second wave. Who knows if the virus mutates? Could be worse, could be better. Let's do what we can to protect everybody now and in the future. So if we do get a second wave, it is not as deadly as the first one. Sandra and Marley.
We spoke about this last week. I just wanted to circle back around to it. The Erie County Legislature is requesting information regarding overtime accumulated by managerial confidential employees, particularly in the sheriff's office. But I think throughout they're looking for follow-up documentation. Just didn't know if there was anything further that you wanted to say about that in terms of the legislature's requests, or what's the highlights will attend the sheriff's office?
Well, I actually had a conversation with the undersheriff, Mark Whipperman, about the sheriff's overtime, and I said, you better be able to produce documentation. He said, I'm going to be able to produce documentation for myself and others. I said, okay. We have produced documentation and provided that to the Erie County Legislature with regards to the Health Commissioner and the Department of Homeland Security and Emergency Services Commissioner. And I did talk to one legislator who looked at that documentation and said, I didn't realize you guys worked that much. I said, what do you think this was, 9 to 5? This was getting here at 8 o'clock in the morning and leaving at 10 o'clock at night and getting text messages and emails from Dr. Burstein at 3 o'clock in the morning, which she still does. But that's what it was. I mean, it was it was 16, 18-hour operations per person during those first couple months. So we have the documentation to back it up on our end. If somebody abused the system, as I said last week, they should be held responsible. They have to pay it back. And anytime you do something like that, it's theft from the community. And we've terminated employees in the past with regards to abuse of the system by saying they worked a certain number of hours when they actually didn't. So the undersheriff said that he told his folks at the beginning of this that they better document all their time, including their overtime. And we've gone through this before with the federal government with regards to the October surprise storm and the FEMA reimbursement and how the Homeland Security Department tried to recapture some of the funds. and we had to provide all kinds of documents. We've always assumed that there were going to be audits by the federal government or the state with regards to the funds, and considering it's being paid for by the CARES Act, subject to potential audits by the federal government. So if there's no documentation to prove it, then they shouldn't have gotten the overtime. Marley?
Two quick questions. First, being for you, Pennsylvania has announced they do not want Toronto to play there. Would you still want them to play in Buffalo?
They don't want the Blue Jays?
No, this happened as of 3:15.
Wow. Well, let me give you, I just was told that Pennsylvania does not want the Blue Jays to come to Pittsburgh. So let me tell you exactly the conversations we've had with the Bisons with regards to the Blue Jays. People are like, this is terrible. You bring these people into town and they just go and party. Here's what would happen. Major League Baseball, through the Blue Jays, would be basically renting full hotels for the season. For the Blue Jays, their administrators, their trainers, their managers, staff, one or two hotels, and then other hotel for the travel team. They would be quarantined, never to leave the hotel except when they're going to the baseball game. They could not go into the general public. It's one of the reasons why the Blue Jays players said they wanted to play in a major league park, because if they were going to be quarantined, stuck in a hotel for every other minute of the day, they at least wanted to play in a major league park. That's what I was told by the Bisons. It's told by is reiterated from the Blue Jays ownership. So then there would be no fans that would be allowed to attend the games. I had a lot of people call me saying, man, can you get me tickets for the Blue Jays games? And I'm like, no. Why? Because there's going to be no tickets. No fans are allowed in the baseball games. So what you have is the team coming in, the Blue Jays, which would have been locked down in a hotel. They basically, my understanding is they'd already secured the rights to at least one hotel, I think two hotels, in which they would have bought the whole hotel for the life of the summer. So that hotel would have gotten business. The staff would have been hired. They would have needed food and beverage. So restaurants would have been retained to provide food and beverage for the Blue Jays, their staff, and so forth, who were sequestered in the hotel. And then the opposing team would have to do the same thing. They'd have to have, there was another hotel that was going to be designated for the opposing team, which would include the New York Yankees and the Boston Red Sox and the New York Mets. So they would come and play a game into Buffalo, but they basically would take a charter flight, land at Pryor Aviation at the airport, take a bus down to the hotel, stay in the hotel, go to the baseball game, and then fly back out. No commingling of baseball players, staff with the general public. And that's why we felt it was safe. We felt it was safe in that regards because we knew there would be no commingling of the general public with the staff or with the players. Of course, the stadium needed more work, needed to change its lights. They wanted some additional work done as well with regards to having additional batting cage and some other clubhouse stuff. My understanding from talking to Bisons, it was all doable. The Blue Jays thought it was all doable. The players wanted to play in a major league park. If Pennsylvania won't allow them to go to Pittsburgh, they're going to have to look for another home, and maybe we're still in line. I would not say bring them here if I thought it was unsafe. Because of the protocols that were being put in place to ensure that the players would never come in contact with the general public, so you would not see the players partying on Chippewa Street. It just wouldn't have happened. They may have been partying in their hotel room, but they wouldn't be partying on Chippewa Street. So I felt in talking with others that it was a safe option and we could handle it here. If Pennsylvania is not allowing the Blue Jays to play in Pittsburgh, maybe we're still on the table. They have to make a decision soon because opening day is tomorrow. The home games did not start here or would not have started in the Toronto stadium, but they're going to have to make a decision soon. If it wasn't safe, I wouldn't say we should be an option. I believe it was safe. We've had problems with local teams going to tournaments outside of our region in Ohio and other places. That is actually putting the public more at risk. When a youth baseball squad goes to Ohio, let's say Columbus, Ohio, and participates in a tournament where there's teams from Michigan and Indiana and Ohio and Pennsylvania and New York, and then they come back, even though they're not supposed to, but it's happened, they're putting the public more at risk because then the kids go commingle with their friends. the parents go to work. That's putting the public more at risk than would have been having the Yankees fly in, stay at a hotel, play 2 games, and then fly back out. And it would have been pretty cool to see a judge try to knock some dingers out of Salem Field, which I'm sure he would have been able to do. And it would have been the first time in more than 100 years that Major League Ball would be played in Buffalo. Granted, it's only 30 games, but it would be pretty neat. And I think it would be a nice diversion for the public to be watching through the news and seeing on television, because all games would have been broadcast, whether it was on ESPN, Fox, Major League Baseball. They all would have been broadcasts. It would have been pretty cool watching the Yankees play the Blue Jays or the Boston Red Sox play the Blue Jays at Salem Field. Follow up? Can you see the field? No. No. You can. Oh yeah, you can see. You can see the top of the stadium, but you can't see anything else. Yeah.
So I actually have a quick question for Dr. Burstein. Our newsroom received a tip that Kaz's in Blaisdell at the bar was shut down by the health department. Are you able to confirm?
That is correct. I can confirm that. I believe they've offered a corrective action plan, which is being reviewed. The failure to follow proper rules.
Repeatedly.
Yeah, it wasn't one. It was multiple. There were at least 3 times they were there. But yes, they were shut down. They were they were warned. They're given violation. Did you do the warn like a little? I like that. They were slapped on the wrist. They were warned. They were notified. They had multiple visits, and they were on the 20th determined to have violated again, and they were shut down. My understanding is they put in place a corrective action plan, which will be reviewed by the Erie County Department of Health. If it's appropriate, they'll be reopened, just like the stage was, and just like the Cowboy was.
Can I talk about the harassment?
Yes, we had some issues with not only at Kaz's but other places where our Department of Health inspectors have been treated very poorly, such that we've had to also show up with sheriff's deputies because they've been harassed. They've been basically told to go where the sun doesn't shine, things like that. And I want the public to know that our sanitarians are there to work and protect the public's behalf. The inspectors are there. They have a job. They're here to protect the public. And when you apply for a liquor license, a food license, you're applying to have the government say yes or no whether you're going to get that license. If you serve food, you have to have a license from the Department of Health to safely do that. So we have the power under New York State law to enforce the provisions of the rules that have been put in place by the governor, and we will do that. And we've visited many establishments. I think that's an important thing to say. We've visited many establishments. Almost none of them, I should say almost all of them, have been given the A-OK, that everything's fine. You guys are doing a good job. I hope you do well financially. Great job. Occasionally there's one that's not doing well. We'll give them notice of a violation. And if it's done repeatedly, we will shut them down. That's what happened with Kaz's in Blaisdell. I think go ahead. I think.
I just want to follow up on Sandra's last question real quickly. I think it's been established that OT for managerial and confidential employees it was established, it was legal. I think a lot of people understand why it is done because of the hours needed during a crisis. Some people don't agree with that, but here's the thing. I think we can see how that was put in place for something like a 3407. An October surprise. But this has become a perpetual crisis with no end in sight.
Well, 3407 took a long time, took months.
I think you know where I'm going here. This has become a perpetual crisis with perhaps no end in sight, at least in the immediate future. And what would be a reaction if the legislature were to try and say we need to either curtail this or put a
Well, first off, there's nowhere near as much overtime being incurred now as there was in March, April, May. It's just dramatically dropped. It's as simple as that. During those periods, it was not uncommon for managerial, confidential, and civil servants to be working 18 hours, 16-hour workdays. That's dropped. Now, pretty much we're back to 8-hour shifts. So the overtime, even if we're still in a emergency situation, is not being incurred anywhere near where it was before. And if it is being incurred at the same rate, as I've told my department heads, something's not right. You shouldn't be working 80 hours a week now. If you are, it's making me question the work that's being done, and none of them, to my knowledge, are doing that. So there has been a tremendous reduction in the amount of overtime. There was a reason why this was put in, and it was in regards to 3407, which it took a long time to deal with. And you had civil servants that were working under managers who were working the same amount of hours as the managers, who, because of the prior rules, were making so much more money because they were getting paid overtime at the overtime rate, and the managers were not. So it was a matter of fairness that here you have commissioners, deputy commissioners, other high-ranking assistants that are managerial confidential employees who are working 16-hour workdays, just like the civil servants who are working 16-hour workdays, but the civil servants were getting overtime and the managers were not, such to the point that the civil servants were making more money on an annual basis than their managers, substantially more. And it caused a problem where people didn't want to leave civil service to become a manager because they said, why would I do that? I make more money as a civil servant. It's the example that we've seen with regards to the elected offices, where they say, well, why won't certain members of the controller staff run for controller? Why wouldn't the deputy county executive run for county executive? Well, it'd be dumb. They'd be taking a huge pay cut. My deputy county executive makes tens of thousands of dollars more than I do. The controller makes tens of thousands of dollars less than the deputy controller. And that's just how it is for elected officials. But it shouldn't necessarily be the same for the leaders of departments who have to work side by side with civil servants working the same amount of hours. It was a matter of fundamental fairness for that. If somebody's abusing the overtime, then we need to go after that individual. If they abuse it, if they earn it and they're working hard, it's a government. People don't work for free under the governmental rules. You have to pay, you have to compensate them.
But did you see the difference between the spirit of it? If the letter of it is fine, it's the spirit of it. Some people are questioning, because this has become a perpetual crisis.
If there's one thing I've learned is that,
Maybe there should be, a limit.
David, if there's one thing I've learned is that people will question anything that we do. It doesn't matter what it is. I could say we're going to give everybody in Erie County $10. Someone will question saying, that's no good, I want 11. It's just how it goes. There's always going to be people questioning. And when it comes to issues associated with the coronavirus, as I've said, I don't really care what the individual opinion of a person is. I care about scientific fact. We know masks matter. We want people to continue to wear their masks when they're out in public and they cannot safely socially distance. With that, we'll call it a day, and I'm going to learn a little bit more about what the Blue Jays are planning on doing. I do believe that they were capable of converting the Salem Field over very quickly so that the lights could be used. Other things need to be addressed. It just goes to show what we're dealing with in this time. But as we say to each and every one, otherwise, as we conclude, I want to make sure that everyone is safe and well. We offer our deepest condolences to those who've lost a loved one in this unfortunate virus outbreak. And the best way to protect yourself and to protect others is to wear your mask. Thanks, everyone. Be safe and well.